You're watching TVC News at 5. Let's turn our attention to talking health matters. Nasarawa state government has flagged off the mass COVID-19 vaccination campaign in the state. The scheme, which is piloted by the National Primary Healthcare Development Agency, is expected to reach all nooks and crannies of the country. Godwin Agwa has more in this story.
The outbreak of the COVID-19 propelled scientists across the globe to embark on research findings, and this enabled them to come up with vaccines for the containment of the disease. In March 2021, Nigeria received 4 million doses of COVID-19 vaccine, but this was inadequate as less than 10% of the country's eligible population were vaccinated. The federal government has received another 33 million vaccines, and it is rolling out a mass vaccination campaign. The National Primary Healthcare Development Agency is in Nasarawa State to flag off the campaign in the state. It is aimed at curbing the spread of the virus and its variants. The exercise is expected to be taken to all nooks and crannies of the state by this set of medical volunteers.
In festive periods like December, we frequently observe mass gatherings for social events. With the rapidity with which COVID-19 spreads, these gatherings are a source of potential risk where unvaccinated individuals are likely to contract the virus. Furthermore, there is now evidence that a more lethal strain of the COVID-19 virus is making the rounds in some countries. This holiday period presents a risky period for importation of these lethal strains. This is one of the major reasons why the federal government came up with the mass vaccination campaign.
So we have to continue to go to all the schools, and I'm happy and I thank all the students from the School of Nursing, that have come out in mass to get involved in this. And we have to go ahead and carry it out at the various levels, the markets, the schools.
The WHO and UNICEF are on ground to ensure the success of the vaccination campaign.
Leading agency in vaccine and vaccine management. We are working with government, with the states, with NPHCDA, with Ministry of Health, with partners like WHO and other global and international partners like COVAX and Gavi to ensure that vaccines are available.
The local government authorities and religious bodies believe that the mass vaccination would be effective in containing the virus.
We'll make sure all this gets to the root. As grassroots, our work is going to be advocacy, sensitization, and advocacy and implementation.
This mass vaccination exercise is expected to cater for at least 40% of the country's eligible population. Godwin Agwa, TVC News, Lafia.